Pediatric liquid medications. This is a classic high alert medication in the community setting, not specifically because of any particular adverse reaction or side effect of these medications, but because of the risk for inadvertently giving them the wrong way or giving the wrong amount. Because again, remember, in the community setting, we're primarily relying on non-healthcare providers to take or self-administer or give their children these medications. And pediatric liquid medications come in all sorts of concentrations, and you have to carefully measure out the dose in the context of understanding what the concentration of the product you're using is. So if you go over the counter at any pharmacy, you're going to see multiple different, I'll give an example, acetaminophen products. You might have an infant acetaminophen drops product that's actually quite concentrated, and that allows for the administration of relatively small volumes of drug to give enough drug to the infant. And then you might have a pediatric liquid suspension that's actually a much lower concentration because older children can tolerate higher volumes of drug, and it's a little easier to measure those less concentrated products. And it's very easy to confuse the two. So a parent might be familiar with the dosing for the pediatric suspension and accidentally buys the infant drops and gives the same volume of the infant drops, which could represent a multiple-fold overdose of acetaminophen. And pharmacist soapbox here, acetaminophen is generally recognized as a very safe medication that people take all the time, but it's actually a potentially highly toxic medication. It doesn't take too much of an overdose of acetaminophen to cause a life-threatening liver toxicity episode. So there have been numerous case reports of harm being done to children because of inadvertent dosing errors with these pediatric liquid formulations. So these are definitely high alert. It's important to ensure when patients are buying these products over the counter or receiving a prescription that they understand the dosing. This is always a great opportunity to make sure they're getting counseling by a pharmacist, because again, it doesn't take much of an error here to really cause some harm.